Good morning, everybody. Thank you for taking a few minutes to check out our webcast. We're going to talk about ACA reporting today, getting ready for the filing season that's coming up, and then looking at the 2024 rule changes. There aren't that many, but there's a couple and some things that you should be ready for when first of the year shows up. And unfortunately, that's going to show up very, very soon, because I thought yesterday was July 7th, but apparently not. So I'm Bruce. I'm with Atrix Software. Been in payroll reporting for over 20 years, almost closing in on 30. So I spend a great deal of time with this stuff, and we'll share a few things. So again, we're going to talk about 2023 filing as we get into January and get ready for that time, and then the changes that are coming on for 2024. The IRS, the biggest reason we're going through this is very simple. The IRS penalty for failing to meet the compliance standards could be as high as $360 per employee. Those get steep very quickly. I mean, they're reasonably forgiving as long as you're making a good faith effort, but being late is not often forgiven unless you get things done, caught up in a very timely manner. So obviously that's the primary reason. Who has to file? It's pretty easy. Anyone with 50 full-time or equivalent employees have to comply with the Affordable Care Act requirements. There's a few things, there's a few little bits of nomenclature that you should be aware of. The ALE, that's the applicable large employers, are required to file ACA Form 1095 annually. And as you're getting ready for this, employers should consider at least 4 or 5 things that we're going to look at. By the way, an ALE doesn't mean you have 50 employees in a single company. If you control 2 or 3 EINs and you have a total of 50 employees, you fall under the application of applicable large employers. So the 5 things that we're going to look at, again, the e-file threshold has been lowered for 2023. That's going to affect a very large number of people. With that number having been 250 for a very, very long time, the e-file threshold is now 10. So we'll talk about that. We'll talk a little bit about safe harbor codes. I'm not going to go through all the safe harbor codes, but we'll talk a little bit about why they're important. ESRP, we'll define that. That's another one of those little pieces of nomenclature you're going to need to know. Those penalties are rising, as we mentioned. We're going to talk about deadlines, make sure you know when you need to get your filings done next year. And we'll talk about which forms you should use. Again, pretty straightforward stuff. The new e-file threshold is a big one. It is down to 10 now. So if you're filing more than 10 informational reports, so that means if you're filing 10 W-2s, you have to e-file them. If you're filing 10 ACA reports, which, by the way, since the requirement is 50 or more employees, obviously most of you are going to fall under this requirement. Even though maybe you used to be able to file on paper, that's going away. And I would plan that eventually they're not going to accept paper filings at all. But if you are required under the rule of 50 employees or more, that e-file threshold applies to you, and you will have to e-file those reports. And that begins this year. So be prepared, take a look at some things, and make sure you have your options ready. Safe harbor codes. The weird thing about ACA is that employers are required to know roughly what household incomes are of their employees, and there's really no way to know that. You're not going to know how many jobs your employees or their spouses have, and you're not going to know what their total income is from investments or anything else. So the long and short of it is the feds created these things called safe harbor codes that provide you the options for calculating what that affordable standard is. We're going to talk a little bit about that affordable standard as we move into 2024 again as well. But so you'll have to look at that. Now, the selection of the correct safe harbor code for each employee is critical. They may not be the same for all of your employees. They may be different from employee to employee. And that's very critical to know that you're doing the right thing. Not going through them because they are fairly involved. You need to consult with your provider. Most of you will fall under a certain category, and most of your employees will fall under a single safe harbor code. But in order to make sure that you're in compliance, talk to your provider, your insurance provider, or get an ACA specialist to take a look at your codes and make sure that they're correct. The ESRP penalties, again, here's one of those little terms that's used for ACA. It's the employer shared responsibility provisions, and those penalties fall under two categories. A means that you're not offering group health to at least 95% of your full-time employees, and B is that you're offering coverage that is considered unaffordable or doesn't meet the ACA minimum standard. So those penalties have gone up. They went up last year. They're currently $240 a month and up to $2,880 per employee. Under the penalty A and under penalty B, they can be up to $4,320 per employee, or that $360. Now that $360 per employee is per month that you're in violation or that you're in non-compliance. So those numbers get very big very quickly. Deadlines are pretty easy to know. If you have 50 employees, you're required to file those 1094 and 1095 forms. Generally, they're Cs. 1094 is the federal form. 1095 is the one you send to your employees. Cs mean that you are paying for a insurance provider. If you are self-insured, then you'll be using the 1094B or 1095C, and those deadlines are exactly the same. So you have to furnish those 1095s to your employees no later than March 4th, 2024 this year, this upcoming filing period. If you are filing on paper, which I'm going to tell you, I don't think any of you qualify for, because if you have to file ACA, you have more than 10 employees and more than 10 forms, you're going to have to file electronically, and that deadline is April 1. Again, the correct form is the 1094 and 1095. The 1094 is the form that is the transmittal form. It's like the W-3. It's the form that goes to the federal government. It's a summation form, gives total numbers and total information. The 1095 is what's sent to the employee. The 1095, 1094Cs are if you are paying a provider to offer coverage to your employees. If you are self-employed, then it will be the 1094B and 1095B. So what's new for 2024? So going into next year, obviously that same e-file threshold applies. That affordable standard that we talked about, that's the percentage that your employee is, the maximum percentage of their income that they are allowed to pay for their insurance. So in 2022, that was 9.61%. This year, it's 9.12%. And 2024, that's been lowered again to 8.39%, which is wonderful news for employers, which means as health insurance gets more and more expensive, the amount that an employee can pay for as a percentage of their income becomes less and less. So those things make this difficult for employers, obviously. Those ESRP fines that we talked about, those have gone up. The A penalties, so if you're not providing coverage for at least 95% of your full-time employees, that's gone up to $247.50 a month, or a total of $2,970. And the B penalties have gone up to $371.67, or a total of $4,460. The biggest thing to take away from this is protect yourself. Make sure that you're complying. consult with your provider. They're virtually always willing to give you information because they're part and parcel of compliance, and they typically have experts on file or on staff that can help you picking out safe harbor codes and taking care of those things. Use an e-file service, whether that's one that's integrated into your current software. Use them. That gives you a much better chance of making sure that you're complying. I would also recommend that you use Social Security verification so that you know that your SSN numbers match with your employees. Hopefully you're already doing that for W-2 filings, and so you'll have that information. And then with the service, you'll have the functionality of some solid error checking. And that'll just make sure that your totals match, that certain columns can't be bigger than other columns, and that you're complying with those minimum requirements, and that your safe harbor codes make sense. So use an e-file service when you're filing. As a bit of self-promotion, I'm with Atrix Software. We integrate with over 70 different payroll and HR providers. If we're integrated into your service, by all means use us. We do offer a standalone product. It's WeFile by Atrix. You can go to atrix.com and you can find us. And we'll be able to help you out with getting that e-file standard met. So be ready. Take care of everything that you need to take care of. And we'll see you down the road. And hopefully we can take care of anything. If you need to get a hold of me, you can contact me at bruces@atrix.com. If you have any questions, let me know if I can be of any help. Thank you for tuning in today. We'll get this posted on our social media sites so you can review it if you'd like at your leisure. And we'll see you next time we have one. It'll be sometime in November, and we'll send out some notices and let you know. Thank you. Have a good day.